I'm putting on a different hat now. I am now, how many of you charter schools participate in either getting reimbursed for IEP required direct medical services or participate in the Indiana MAC program? Any charter schools? So a couple? Okay. So that's what I'm here to talk about. I'm talking about schools' ability to recover unrestricted federal money that can help your school in whatever endeavors you decide to use that money for. It's unrestricted. Last year, schools, and for 2017, $20 million. So we're going to go ahead and talk about school-based Medicaid funding. I'm going to briefly kind of go over Medicaid in general. There's some people, me included, get confused between Medicaid and Medicare. Medicaid aid, think about that for low income. It doesn't always necessarily mean low income. I'm a parent of a special needs student, a child with a disability, and he has Medicaid, but he has it through the Medicaid waiver. Anyone know about the Medicaid waiver? It's fantastic. It's how I went to law school. It's how I graduated, and it's how I do what I do today. I was able to focus on my studies and have a assistant, a caregiver come into the home, take care of my child, take him to therapies, and it put me where I'm today. So it's a fantastic program. But he wouldn't be included in what we're talking about today because he's not based on income, he's based on need. We're also going to talk about the IEP required direct services and what charter schools can do in getting recovery of some money that they're spending to provide services that they already have to require pursuant to the IEP. We're going to talk about the administrative claiming. Schools have a requirement to have that medical service plans outreach for those students and help them with their unmet medical health, mental health needs, dental needs, vision. Statistically, schools spend 6% of their time on those, and so this is a way that you can get some additional recovery of funds that you're already spending. And then we're going to give you some resources. So Medicaid is the health care plan to eligible low-income pregnant women, adults, disabled, elderly. We're likely all familiar with it at this point. The state of Indiana has a definition on what services are provided by Medicaid. That's the controlling factor for if you can use those to recover funds. The FSSA's Office of Medicaid Policy and Planning administers Medicaid here in the state, and it's funded through federal and state dollars. So there are two types. This is where it gets confusing, and I understand Medicaid is very confusing. I'm still learning about it in my role. So if you have questions, you can raise your hand or you can send me an email at the end. But there's two different programs, and they each have different rules, methodologies. So we've got the IEP required direct services, and that's where it pays the Medicaid rates for providing these health-covered medical services. That's in the IEP, and it has to be for a Medicaid-eligible student. And then there's the Medicaid administrative claiming that we talked about, and that pays a portion of your costs that you're already paying in performing those administrative activities for students and families for their unmet needs. So both of them still have federal and state Medicaid and education laws and rules that apply, and it's providing required related services to these students. So you as a school, what the Congress did is they allow you to have access to these students' public insurance benefits because you have to be providing them anyway. And IDEA was originally supposed to be funded by 40%, and it's historically been funded about 20%. And so this was the way that Congress passed this law to allow schools to bill and get reimbursed some of those federal dollars as a way to make up for that deficit. So, my statistics. Last year, we had for IEP required claims, we had 166 school districts participate. $15.5 million recovered, and IPS passed for the first time, our first school district, over $1 million. And again, it's unrestricted. And then for the MAC claiming, this administrative claiming, 148 schools participated, 4.9 in the federal fiscal year. So federal fiscal year is a little different. It's October, so we're still in 2017, but we're expecting to surpass $5 million this year. So over $20 million back into the direct budgets for schools that they wouldn't have if they didn't participate. So charter schools, what I realized when I was doing my research for this presentation is that you don't really do a whole lot of the IEP required direct services. There's a lot of legality and a lot of responsibility for schools, and you have to meet certain credentials, and we'll get through that. So there are only 4 of you that participated, and it was just over $10,000. For the MAC program, we have 37 schools that have enrolled, and I don't have a number. I just didn't have time to calculate it all. But it's significantly more than the $10,000. So the Department of Education, and my role and my responsibilities is that I work with the Medicaid agency, and I help. So I listen to you schools on what you think you're doing for those medical services, and then I pass that information along. One of the examples is right now there's a debate. Well, the ABA therapy, schools can now get reimbursed for providing, as long as it meets those criteria for ABA therapy, and it's in that IEP, and we're talking about telemedicine right now. So we'll know in about 9 months whether telemedicine will be added, which will be huge to the virtual schools. I also help, like I said, with the policies and rules and legislative changes, which is very exciting, and am there to provide technical assistance to you schools. And then I monitor the contract for the MAC program. And then I'm also, like for tomorrow, I'm doing a presentation on how you can blend and braid this additional funding to help schools meet those needs that they have for their budgets. So it's very exciting work. And let's see, what can you do with your money? Well, the proceeds from Medicaid's unrestricted. So we just talked about that. It's not program income for the considerations. It's not considered maintenance of effort. And typical uses, so staffing, you can help pay for your staffing, therapists, nurses, psychologists, health screenings, mental health services, purchase that equipment that you much need. So I talked to schools, one school in particular, and I don't know the name of the IQ test, but it was like I'm not even gonna, yeah. It's one of those IQ tests. It was $100,000 for the protocol and the materials. They used their Medicaid funding to purchase that. Otherwise, they would have had to go before the school board and with capital projects, and instead they just routed that money and paid for those. Another school sent 15 of their teachers and staff to professional training, and they paid for the traveling expenses, the registration, and the substitute teachers that they needed to fill those roles while they were gone. There's a lot of great things. There's a school I'm talking to right now that's proposing a reading program for all readers, or for all students, but focusing on the students that are below level reading, with the goal that every single one of their students in their corporation will be reading at grade level by the 9th grade. So there's just a tremendous amount of things that you can do with this money, and which is why we're here to help you. So what schools are participating, and how can you learn more? Well, I can't, as the representative, just say, okay, this is what you need to do based on your school. What you need to do is find schools that are similarly situated as you, and talk to them and see how that enrollment process works. What did they do? Is it beneficial? What are they doing with their money? How can you find this out? Well, you go to our website, the Department of Education Office of Special Ed, and there is the school-based Medicaid website. And there's what's called the school-based let's see, where is it? Oh, the School Corp Medicaid Reimbursement Report. It's an Excel spreadsheet. It's very overwhelming, and if you need help with, locating things, let me know. I could be more than happy to help you. But that will tell you every single district that's participating. Charter schools are listed on there, and what they made or what they were able to recover from those federal funds. So it'll give you an idea of the benefits to you, and it's for the medical services that are provided pursuant to the IEP, and it's also for the MAC program. So we're going to talk just briefly about the required services because I see that most charter schools are interested in this area. But this is like when the case conference committee makes that decision that that student needs those medical services in order to access that curriculum, and they put that in the IEP. Medicaid will reimburse for if it's a Medicaid covered service that's provided to that student, and that student has Medicaid. So there's a couple of caveats to take to consideration. So it reimburses at Medicaid's rate for each related service, as long as that's a Medicaid eligible special ed student. So the school has to do two things. They have to provide written notice and get assigned Medicaid consent. Our website has a sample, so the Department of Education offers a sample of notice of procedural safeguards, and the Medicaid waiver, the Medicaid notice is part of that. And then Indiana IEP also has it in their system. So you've got two options already, but you can use your own as long as it meets all of those criteria. And the point is that free means free. So it's a free, appropriate public education. You wouldn't be able to bill my child, even though he has Medicaid, because he has private insurance. And Medicaid is a payer of last resort. So they would have to bill my private insurance first, and then that would be at an expense to me. So it would take some of my benefits away, and then you would no longer be providing that free, appropriate public education. So, you have to be very careful, and I think that's probably why there are 4 of you that are participating at this time. So you can get reimbursed as long as it's a student that's eligible, it has an individual education program, it's furnished by that Medicaid qualified provider, and when ordered or referred by meets the criteria, the physician, the licensed practice, the IEP itself often operates as that prior authorization. And then there's just additional qualifications and requirements. Here's some of these this is what Medicaid covered services are for the schools. And I did change it. I took this out because evaluation and treatment applies to all of these. But this is an older version of my slide, so I apologize. Your handouts should be accurate. But it's OT, PT, speech, ABA, hearing, nursing, behavioral health, and in some situations, transportation. So these are things that you're already doing. And as long, depending if you have a student population that has Medicaid eligibility, might be something that you might consider. So we have some common questions. I'm just going to go to, will the schools claiming affect the Medicaid benefits? Not as long as it's provided through the regular Medicaid. So again, the waiver, there's some plans. So we have to make sure if the school bills for a covered IEP required service, will Medicaid also pay for other services to the student outside of that? Well, yes, as long as the services aren't duplicative and it's necessary for the student. And then you already get special or Part B money. So why would you get this additional? Well, again, it's because it's underfunded idea. And this is a way that Congress was going to make up to the schools additional funding. Here's the MAC program. Here's where I think most of you are going to find information that you need and considering participating in this. So the administrative claiming allows you as a public school, the charter school, to recover unrestricted federal funds, and reimbursements are paid quarterly, and it gives you flexibility for education services, materials, equipment, training, and these are ways that you can address and arrange and meet the students' unmet needs, because what statistics show and what we know is if a student has medical needs that are not being addressed, and they can't see, they can't hear, or they've got some mental health issues that need assistance with, they're not really in the classroom. And so it impedes their learning. And so this is a way for you to help not only it's basically for the holistic child.
So what does that mean, that you can send them for those services and then they reimburse?
This is the MAC part. So schools have an obligation for helping students with their to meet those unmet medical needs. And so this is for like the staff. You're getting reimbursed for those staff time spent doing that. So a lot of you help students fill out Medicaid application forms, or schedule an appointment for a mental health service in your community. And you get reimbursed for some of that time that you're doing spent on that. What we all know is that once a student's needs are being met outside of school on the physical and mental and medical, then when they're actually present in school, it lowers absenteeism. They're paying attention, they can focus. So it's just another way to meet those needs. And you get a recovery of those funds that you're already spending. So we have one vendor in the state, and that's PCG. And then you as the school would contact PCG, and you would have to contract with them to participate in the program. There's 3 components in order for this methodology for you to recover these funds, and it's participation in the random moment time study. And so some of you that already participate in it, you'll get an email, and you'll just answer like, what were you doing yesterday at 12 o'clock? And you type in, I was at lunch. Well, that's not going to be a reimbursable activity, but it doesn't matter, because what we're looking for is overall, out of an entire day, randomly throughout the state, how much time did school staff responsible for this outreach spend on it? And statistically, it's about 6%. So then that's how we figure out, based on, how many students attend your school that are eligible for Medicaid. And it's an algorithm, but that's how we figure out how much money you get back. And then we go through the staff pool list. So those staff members that are responsible for helping, a lot of your counselors, social workers, administrators that help kids find that insurance that they're lacking, or help make referrals or develop programs for outreach. You probably have health clinics and things. Those people you would put on a list, and those would be the ones that would get that could get that random sample question. And that's where the salaries are based off of for you to get your reimbursement money. And we need your financials. So schools upload their financials to PCG. That's how they know how much they make in order to do that whole algorithm. So here's an example of some of those activities that we were just talking about. Providing information to students and families about public health care benefits. I'm sure a lot of you already do that. Referring a student for a mental health diagnostic and treatment services. Getting information, so getting all of that information that you need to get that referral. Attending meetings and trainings related to Medicaid. And developing strategies to improve on delivery for these children. So charter schools, out of 104, 37 of you are enrolled in the program. And I wanted just to kind of give you we talked about the financials and the random time moment studies. Those are requirements that you have to get back in order to get these funds. And so we had 7 that were late in the state. 3 of them were charter schools, so 3 of the 37 were late. And on random time moment, the current rate's 98% that we get responses back from the staff members that are on that staff pool list. Is our agreement with the federal government to get those federal dollars. It has to be 85% or greater. We had 129 of our schools. We have about 141 schools participate total in the state. 129 of them are at 100%, and we had 1 charter school that was at 50% compliance. And then in order to get the funds, you certify with your certified public expenditure form. You just are signing a form that was your claim, and this is what your reimbursement is, and that you did what you're saying that you did. And that's all that's necessary. We had 3 that were late, and it was with 3 charter schools. So here's the resources. Your resources actually include one additional one, and that's from FSSA, who created a school resource book, and it is called Indiana Health Coverage Programs Provider Reference Module. If anyone's interested, it's a 9-page packet. Just send me an email and I'd be more than happy to send it to you. I'm going to be posting it on the Learning Connection, but we are on the Learning Connection as well. And there's a toolkit on the Office of Special Education's website for school-based Medicaid. And that gives you it's a very complicated book. And it's very thick and can be overwhelming, but it's all of the requirements that you need to be able to bill for those medical IEP services that are in the medical nature for that Medicaid funding. The billing guidebook is more of an overview. It's a lot easier to read and understand about what we just talked about. And as always, our website, and then there's the National Alliance for Medicaid and Education, who does a lot of outreach to legislators to let them know what the benefits of Medicaid is for the students and for the schools. So we all remember the healthcare debate that was going on this summer. Well, part of that was there was a threat to take away this program from the states and from the schools. And so that organization really did a lot of outreach to help educate those representatives and senators on the benefits that, you know, directly flow to you and why they need to keep that program. So do we have any questions? No? Okay. Well, that's it for my 2 presentations.